Hi, it's Noel Williams, Optimal Health Associates in Oklahoma City. I want to talk about something we do a lot of. It's collateral cancer care. What's collateral cancer care? It's when you help cancer patients through their therapy and or help them with different treatment strategies to improve their outcomes. It's something that's an add-on to standard therapy. It's also something you can do if someone doesn't want to do standard therapy or if they've exhausted their choices. So part of the process in cancer care is people get sick. So the first part of collateral cancer care for me is what I call cleanup. We get those patients better. I had a person in last week who was quite ill, and when we did their blood work, they were anemic, they were iron deficient, they had no vitamin D, they were hypothyroid, and the oncologist hadn't ever done any lab work to feel like why they felt so poorly. And the problem with that is, and again, I love the vast majority of oncologists, is that your immune system has to work to kill the cancer. It's not the chemotherapy, it's the immune system. The immune system comes in once the chemo has damaged it. So you have to support that. So when a patient with cancer feels crappy, generally their immune system isn't working and you have to have the basics covered. So first we have cleanup, then we have stabilization, and then we have recovery in terms of someone we see. And then the other part of it is targeting things to help the chemotherapy. They're getting work better. And the problem with, again, this with oncologists is oncologists are going to follow the National Cancer Center Network site because they're really locked into that. And we're not saying to not do that stuff, but we are saying, what about adding things to make it work better? So there's repurposing old drugs. So tons of data on using metformin to help, a lot of data potentially even on Lipitor to lower cholesterol because of things with sugar, which is a complicated subject I'm not going to go into. There's also, antiparasitics like febenzazole and ivermectin that have a role for some patients. All very safe stuff, very helpful. So I think there's medications. And then there's a next step too that you can always look at. We want to support the immune system and help repress some of the secretions that cancer cells make. So there's a role for ozone therapy, and there's also a role for high-dose vitamin C therapy. There's a lot of data with high-dose vitamin C showing significant improvement with outcome when patients use it with their chemotherapy. Again, a very safe process. So collateral cancer care, first and foremost, get the person better, make them be able to live their life even though they're getting chemo. Second, give them opportunities to make their cancer care work better. It's very common sense. It's very straightforward. One last thing, we also think about mistletoe therapy to augment the immune system. So you can always look up mistletoe therapy for cancer. It's very palliative and also can augment outcomes. This is Noel talking about cancer care. We love helping these people. It's as I enter my last 10 years of my career, it is one of my central focuses. So thank you.